preventative wrinkle movement.
Okay, we're live.
On the forehead. All right, lay back, relax, lay back and relax. All right, hey guys, we're on part 2 of our female sort of preventative maintenance treatments. And everybody knows about neuromodulators, or what we call wrinkle relaxers. And if you raise your forehead, you can see some of these wrinkles start to form. Squeeze on in, give that frown. You can see those wrinkles start to form, so relax. What we like to do is soften this and keep it a nice elevated brow. The one thing to note is when people start to get a little bit older, things start to happen, the eyelids start to get a little droopy. Her brows are high, but you can see she's starting to get a little bit of skin. She's very thin. So you don't want to overdo the forehead and do this. You see what happens? Look at the upper lid. What happens when the brow comes down? It gets more droopier. We don't want that. So to make sure that we keep this elevated, we're going to do what's called a chemical brow lift. So squeeze in a sec, relax, and we're going to do a little injection right into this middle portion, very small amount. Squeeze again. Good, relax. We're going to grab that muscle. We're going to go right into the muscle. Just do a very little amount. Squeeze in again. Relax. And these injections work to slow down the movement of these muscles so that we can relax the wrinkles. And then what we're going to do is we're going to come right over here, and we're just going to do a little teeny baby bit, the lateral part of the eye. Squeeze in again. Relax. Now she has a little bit extra in the tail over here, so I'm going to do a little hurt me spot. Do one extra unit right over there, because I want that brow to look really nice and arched and to keep her raised. Now I'm also going to do just a small amount, a smidge, in the forehead, not that much. Raise all the way up. You can see she really has this sort of bi-directional muscle movement, and she has a little arch here. Relax. Raise again. You see this little line right here? If you overdo the Botox, this line becomes accentuated. So what we're going to do, raise up again, relax. We're going to do a small bit on both sides right there, 1 to 2 units. Raise up again on both sides, relax, right over here, 1 to 2 units. So just soften that ridge. We don't want that ridge to happen. Now raise all the way up. Good. And we're going to go over here. We're going to do our typical couple units. Raise up again, relax, go right there. Raise up again, relax. Raise up again, relax, a little bit. Raise up again. We're just doing micro droplets. Relax. Perfect. So now we have just little micro droplets all the way across. We call that baby tox. And now what will happen is in about 10 days to 14 days, it will soften, and she'll keep a little bit of an elevation, a nice arch. This will stop moving as much, and this will soften. It'll keep her open without a droop, and that's exactly what we want. So I always tell people, for today, squeeze in, raise a bunch of times, get that toxin to be activated. There are a lot of myths about Botox. You do not need to ditch your yoga today. You can go work out.
I didn't know that.
Yeah, everyone says this. Even if I tried sitting on my head, a headstand from yoga, nothing happens. Everything is fine. I've never had anybody who went and worked out or did a massage or went to yoga and had a problem. So in general, I don't think you have to stop doing anything. But if you want to be really careful, you can go home and have your wine tonight and a bath, and then you can go to the gym tomorrow.
Okay. Can I do just all three, like wine, bath, yoga?
Sure. Can you do the yoga before you do the wine and the bath? Because I don't want you drinking wine and then doing yoga.
Okay.
So that's it. But how was the pain?
Minimal. Couldn't even feel it. And I didn't even know.
Great.
You're awesome.
So I love that. So I did my little tap vibration. You could see a little cheekbone elevation and just softening of those lines. We'll see her in 10 to 14 days. Bye, guys.